What is conditional cash transfer? The Conditional Cash Transfer (CCT), also known as Household Uplifting Program (HUP), is one of the social investment programs anchored by the federal government of Nigeria, supported by World Bank, to assist poor and vulnerable citizens through targeted cash transfers, capacity building, and livelihood enhancement. It was introduced in September 2016. The Kaduna State Secretary to the government signed the MOU on 24th July 2017, and payment to beneficiaries in the state commenced in December 2017. What are the objectives of the CCT? To address the consumption needs of the poorest and vulnerable households, to improve human capital development of the citizens, to increase utilization of health and nutrition services, amongst others. What are the components of the CCT? CCT is focused on deficiencies in capacity and lack of investment in human capital, especially amongst our poorer citizens, through the following. 1. Cash transfers. To deliver timely and accessible cash transfers of 5,000 naira per month to beneficiaries, which is paid on a bi-monthly basis. This type of payment is given to all eligible households selected from the National Social Register (NSR). Note that beneficiaries are expected to stay up to 3 years before graduating from this program. 2. Capacity building. This aims to enhance empowerment of benefiting households to be self-reliant. They are trained on enduring life skills and savings group mobilization and micro-business development (SGMB). 3. Livelihood support. This aims at complementing the cash transfer to help benefiting households to build a mindset of enterprise development in order to reduce abject poverty in communities and create opportunities for work, both on farm and off farm, especially amongst women and youth. As at December 2019, the number of cooperative groups formed among beneficiaries in Kaduna State was 659, out of which 554 had registered as cooperative societies. 3. Grievance redress. It aims to address and escalate incidents of dissatisfaction and complaints that may arise during implementation in the field for effective and efficient delivery of the program. Now, who manages the CCT? The National Cash Transfer Office (NCTO). The National Cash Transfer Office delivers targeted cash transfers across the country, provides technical support and stakeholders engagement. It facilitates beneficiaries' enrollment and issue program card to beneficiaries. In addition, it also supports capacity building of state and local government areas and integrate the payment services providers (PSP) into the system. Others are to facilitate beneficiaries' training, coaching and mentoring, to monitor the progress of activities at state levels so as to ensure conformity to plans and standards, and finally, to provide grievance redress hubs, which ensure that grievances from states are investigated and addressed. State Cash Transfer Unit (SCTU). The SCTU manages and coordinates the targeted cash transfers and livelihood intervention. It coordinates beneficiaries' enrollment into the State Beneficiaries Register (SBR). Finally, it monitors progress of activities at local government level. The Local Government Cash Transfer Facilitators (CTF). The CTF implements activities at community level. It also delivers training and sensitization to beneficiaries at the community level. Note: the State Cash Transfer Unit for Kaduna State is domiciled in the Social Investment Office in Kaduna. As at June 2020, there were 34,946 beneficiaries of the CCT across 9 local government areas, namely Birnin-Gwari, Chikun, Ikara, Kachia, Kajuru, Kauru, Kubau, Lere, and Sanga in Kaduna State. How are the beneficiaries chosen? Beneficiaries of the program in Kaduna State are mined from the National Social Register comprising State Social Register of Poor and Vulnerable Households, PVHH for short. The social registers are developed with training, supervision and guidance from the National Social Safety Net Coordinating Office. Beneficiaries are identified through a combination of 1. Geographic targeting using a poverty map across states to provide a basis for classification, ranking, and selection of participating local government areas. After which, based on availability of certain facilities, communities are ranked. 2. Community-based targeting mechanism. This allows the community to identify, validate, and select specific members of the community to be enrolled. This entails pre-sensitization, sensitization, mobilization, community engagement, enumeration, and validation of data. 3. Proxy means testing, PMT. The above identified household socio-economic data is therefore subjected to the PMT for ranking of households based on predetermined criteria to list them from the poor to the poorest for targeted interventions such as the cash transfer program. Note: presently, there are 130,959 PVHH in the register across the 9 local government areas, namely Bruningwari, Chikun, Ikara, Kachia, Kajuru, Kauru, Kubau, Lere, and Sanga in Kaduna State. However, as at June 2020, there were 34,946 beneficiaries across the 9 local government areas.